For our project, we did Still Alice.
Alice, where the hell were you?
Went for a run?
Well, I hope you enjoyed that because you completely blew our dinner plans.
I need to talk to you. I got something wrong with me.
What's going on?
Oh boy. He's gonna break up or? No. I have Alzheimer's disease. Early onset.
God.
I can see the words hanging in front of me and I can't reach them and I don't know who I am and I don't know what I'm gonna lose next. Stethoscope. Millennium. Hedgehog. I'd like to see you go to college.
You can't use your situation to just get me to do everything that
Why
you
can't
want.
I?
Because that's not fair.
I don't have to be fair. I'm your mother. I hate this is happening to me.
But we have to keep the important things in our life going.
Merry Christmas.
We have to try, or we're going to go crazy.
This might be the last year out on myself.
Please don't say that.
I am not suffering. I am struggling. Struggling to be a part of things. To stay connected to who I once was. So live in the moment, I tell myself. It's really all I can do. Live in the moment.
Client information. Our client is Alice Howland. She's a 50-year-old Caucasian female, married to John Howland with 3 children. She's a linguistics professor at Columbia University.
Signs and symptoms. The first sign of Alice's early onset Alzheimer's disease is when she was giving a presentation at UCLA. She forgot part of her speech, which alarmed her. The second sign of her disease is when she was jogging around Columbia University and got lost. This startled her since she jogs here often and works at the university. She began to panic before finding her way home. Alice begins explaining her symptoms to her neurologist. She explains how she forgets words, names, and locations. In a memory exam, she forgets the address her neurologist told her to remember in the beginning of the exam. She is then seen forgetting the name of certain objects like a cheese grater or the recipe for bread pudding that she makes every Christmas. Alice also forgets her son's girlfriend and reintroduces herself to her at Christmas dinner.
Our mental status exam included appearance, disheveled, build, thin, demeanor, mistrustful, withdrawn, preoccupied, eye contact, avoidant, activity, slowed, speech, clear, thought content, delusions, none reported, self-abuse, suicidal with intent and plan, aggressive, none reported, hallucinations, none reported, thought process, flight of ideas and blocked, mood, depressed, effect, flat, behavior, cooperative, withdrawn, loss of interest, impairment of memory and attention/concentration, intelligence estimate, above average.
Relevant client history. Alice and her husband John have 3 adult children: Anna, who is a lawyer; Tom, who is in medical school; and Lydia, who is an actress. Alice is a linguistics professor at Columbia University, and her husband is a biologist also at Columbia University. Alice is supported by her husband and 3 children. Her daughter Lydia becomes her support system when her husband moves away for work in Minnesota. She also has a professional caregiver who comes throughout the week. Alice and her family are wealthy, but her husband insists on moving for his job to the Mayo Clinic in Minnesota for financial reasons. Alice believes that he leaves because he does not want to watch her deteriorate.
Risk factors. A risk factor for Alice includes the risk for suicide. Before her memory was severely impaired, Alice recorded a video of herself explaining how to overdose on sleeping pills when she can no longer answer simple personal questions. Later on, Alice finds this video and almost takes the pills as her caregiver walks into her home and disrupts her. Another risk factor for Alice is the risk for depression. Alice states, "I wish I had cancer. I wouldn't feel so ashamed." She feels as though people look down on her for having this disease. She is scared to go to dinner parties and have personal interactions with friends for the fear of making a fool out of herself. Risk for danger. Alice cannot leave the house alone or stay home alone after her suicide attempt. She could potentially get lost or injured if she went out of her home alone. Risk for Alice's children having the gene. Anna tested positive, Tom tested negative, and Lydia did not want to get tested.
Some client strengths are she knows that this disease is not who she truly is. She always holds onto the intelligent woman she was before being mentally impaired by her disease. She accepts her disease and tries to remain positive and enjoy life in the moment. She spends a summer at her beach house and finds happiness in little things such as the ocean or a deep conversation with her daughter. Despite her memory loss, she tries to be as independent as possible. Alice can make food by herself, such as toast and tea, and continues to read books. Alice tries to keep in touch with her children, such as Skyping Lydia every day before she moves in with her.
The DSM-5 diagnosis for dementia, major neurocognitive disorder. Evidence of significant cognitive decline from a previous level of performance in one or more cognitive domains. Learning and memory. Alice cannot remember dates such as John's conference date and the time of Lydia's play. Alice forgets who Lydia is after her play. She also forgot where the bathroom was in her home, so she ended up wetting herself. Language. At the end of the movie, Alice cannot speak words properly. She uses moans to express herself. Executive function. Alice cannot dress herself, prepare meals, or clean her home. Complex attention. As Alice was still trying to teach her class, she could not make the topics flow in an organized manner. The cognitive deficits interfere with independence in everyday activities. At a minimum, assistance should be required with complex, instrumental activities of daily living, such as paying bills or managing medications. Alice needs assistance dressing and cooking meals. Her caregiver cleans Alice's house. The cognitive deficits do not occur exclusively in the context of delirium. Alice does not undergo any states of acute delirium. Her disease develops throughout months of her life after she turned 50 years old. The cognitive deficits are not better explained by another mental disorder. Alice does not have any other mental health disorder. She states that she is not depressed and she does not have hallucinations or delusions.
Here's a video of Alice not remembering where her bathroom is.
Sorry. Hey, look, I found this photo album with these pictures of my mother and my sister. Hey, when are you going to the conference?
Monday.
When is Lydia coming?
Lydia's coming on Sunday.
Okay.
Are we going running?
Yes, we are. I just have to go pee. I'll be right back.
Allie?
I couldn't find the bathroom.
It's okay. Okay, baby.
Nursing diagnosis, risk for suicide, related to Alice creating a video to her future impaired self to take a bottle of pills in order to end her life. Subjective data. Now, there are a lot of pills in that bottle, but it is very important that you swallow them all. And lie down, and then go to sleep, and don't tell anyone what you're doing. I wish I had cancer. Objective data. 50-year-old Caucasian female is fearful about her future with Alzheimer's. Patient expresses the shame felt because she could not remember easy tasks. Patient claims suicide is the only way out. Patient was unsatisfied with the potential nursing care facilities that she would inevitably be in. Patient tried to hide the pills when the caregiver walked into the house. Goals and outcomes. Short term, client will attend group support. Long term, client will not harm herself. Interventions. Short term, encourage the patient to express angry feelings within appropriate limits. Help client to identify true source of anger and to work on adaptive coping skills for use outside the treatment center. Long term, create a safe environment for client, remove all potentially harmful objects from client's access. Scientific rationale. Suicidal behaviors are viewed as anger towards inward on self. If this anger can be verbalized in a non-threatening environment, the client may be able to resolve the feelings. This is a clip of Alice planning her suicide attempt.
They just aren't powerful enough to put me to sleep.
Do you want to try Lunesta?
What about Rohypnol?
That's very strong.
I need something strong. Hi, Alice. I am you, and I have something very important to say to you. So I guess you've reached that point, the point where you can no longer answer any of the questions. So this is the next logical step. I'm sure of it. In your bedroom, there's a dresser with a blue lamp. Open the top drawer. In the back of the drawer, there's a bottle with pills in it. It says, take all pills with water. Now, there are a lot of pills in that bottle, but it's very important that you swallow them all. Okay? And then lie down and go to sleep. And don't tell anyone what you're doing.
Our second nursing diagnosis is impaired memory related to early onset familial Alzheimer's disease, as evidenced by forgetting part of her speech at UCLA, the name of a highlighter, the recipe for bread pudding she makes every year, her son's girlfriend, the way around Columbia University where she teaches, where the bathroom is at her own house, and she has to ask her daughter multiple times when her show is. Subjective data. I've started forgetting things, little annoying things like words and names, and I got lost, completely lost, running on campus. I can't remember appointments, words. It's like something just drops out under me. Everything I've worked for in my entire life is going. It's all going. I couldn't find the bathroom. I don't know where I am. Objective data. Alice starts to panic as she realizes she is lost on campus. Alice stumbles on her words and gets frustrated as she stares at the highlighter and cannot remember what it is called. Alice stands shocked and disoriented after she wets her pants. She begins to cry. Alice can't remember where she left her phone, so she tears through every drawer and jar in her kitchen. She begins to panic and yell at John that she must find her phone before going to bed. A short-term goal is client will verbalize understanding that loss of memory is related to his or her condition and begin discussing stressful situations with nurse or therapist. A long-term goal is client will recover deficits in memory and develop more adaptive coping mechanisms to deal with stressful situations. One intervention is encourage the client to discuss situations that have been especially stressful and to explore the feelings associated with those times. The scientific rationale for that intervention is verbalizations of feelings in a non-threatening environment may help the client come to terms with unresolved issues that may be contributing to the dissociative process.
Our last nursing diagnosis is impaired social interaction related to Alzheimer's disease progression and disturbed thought process, as evidenced by impaired sleep pattern, withdrawn isolation from others. Our subjective data is, I am sorry, but I don't know what I would have been like at a dinner party. I might not be able to remember names or answer simple questions. Never mind, get through an antidote. Who can take us seriously when we were so far from who we once were? Our strange behavior and fumbled sentences change others' perceptions of us and our perceptions of ourselves. We become ridiculous, incapable, comic, but this is not who we are. Our objective data is patient took time off from work, isolating herself from her peers. Patient wanted to spend more time out in Montauk alone. Patient's husband reports her wanting to stay in more and not having any interest in old activities. Our goals and outcomes are short term, patient will be able to maintain effective social interactions with others. Patient will engage in activities that make her feel happy. Long term goal would be patient will take precautions to prevent injuries. One of our interventions is for 1 hour daily, patient will meet with a group, talk, and interact with others. And our scientific rationale is therapeutic relations promote understanding and can establish a constructive relationship between the nurse and the client. Here's a video of Alice and her husband John after Alice forgot about attending a dinner.
Hi.
Alice, where the hell were you?
Went for a run.
You've been gone for over 2 hours. I was worried about you.
Well, then I went to Pinkberry.
You went to Pinkberry?
Yeah.
Well, I hope you enjoyed that because you completely blew our dinner plans. Susan Kirby and her husband?
I'm sorry, I forgot. I have Alzheimer's.
I texted you. I emailed you. There are ways to
John,
manage
I
this.
said I was sorry.
She's the chair of my department, for crying out loud. I had absolutely no idea where you were if something happened to you. Why didn't you bring your phone?
I told you, I can't when I'm running.
Why don't you wear a fanny pack? Is it really that inhibiting?
Yes. I hate that this is happening to me.
I hate it too. But we have to keep the important things in our life going. We have to try, or we're going to go crazy.
I know, John. I'm sorry, but I don't know what I would have been like at a dinner party. I might not be able to remember names or answer simple questions. I mean, never mind get through an anecdote.
I think you're doing great recently.
Relative to what? I wish I had cancer.
Don't say that.
Here's our concept map.
Ethical legal issue. One ethical issue in the movie is when Alice lies to her neurologist. She lies to him to receive a prescription for sleeping pills. Alice plans on using these sleeping pills to kill herself when she is impaired and unable to remember simple questions about her life. Another ethical issue is when Alice's husband John asked her, "Do you still want to be here?" when Alice was not in a clear mental state to make any choices regarding her health. If Alice wanted physician-assisted suicide, it should have been addressed earlier on. The ethical issue of genetic selection was also addressed in the movie. Alice's eldest daughter had a hard time getting pregnant throughout the movie, so she used IVF treatments and tested her embryos to ensure that they did not have the gene. Here are our citations.
Any questions?